We have a number of questions here. We'll take questions 1 to 8. Please remember, for us to allow others to ask their questions, you have to make your question very compact. Just one question so that others can have the opportunity. Thank you.
Good afternoon, Mr. SDF. Good afternoon, Honorable Ministers, the DG and my colleague, and happy Good Friday. Mr. SDF, sorry. In April 2001, heads of states, African Union, met and pledged to set a target of at least 15% of their budget, their annual budget, sorry to say, to improve the health sector. Now that you have a further insight into our health sector, what will you be doing with your good office to ensure that we actualize the declaration made in Abuja in 2001? I believe this will not only help Rachel, but it will also help many women and girls to access quality, good health care. Thank you very much. My second question is for the Minister of Health. I would like to know if there are signs that Nigeria is winning the fight against COVID-19. And if there are any, can we please know? Thank you very much. Sir, this for the DG, please. NCDC. DG, I would also like to know if we are documenting the lesson learned from our response. And I believe Nigerians want to know the implications of community spread of the infection and what we can do to avoid the looming danger. Thank you very much.
Good afternoon, sirs. My name is Juliana Taiwo Balonya. I write for the Sun newspapers. SGF, sir, yeah, I know you have appealed to governors already to be on the same page with the committee. But going beyond appealing via the media, I would like to know, is there any form of engagement with the governors? I'm saying this because of these discordant directives as regards relaxing of restrictions for church and mosque. For you also, sir, and then Minister of Aviation, I would like to know what is the latest with the arrested pilots. Does the governor have the right to declare Caverton helicopters persona non grata? And then to the Minister of Aviation, he said, the governor said he was not in the know of this approval. Can we know the true picture of things? Then to the coordinator, please. You said, part of the protocols was that banks would provide services. Skeletal services. That is not happening. Nigerians are complaining. They don't have access to banks are not providing services. ATMs are out of cash and they are trapped. So I would like to know the situation of things.
Good afternoon, sir. My name is Friday. I'm a reporter with Channels TV. My first question, I would appreciate if the Minister of Health or the DG NCDC can actually provide answer to it. We are having some confliction here as to confirm cases in Bauchi State. I don't know if it was a slip. The Minister of Health said we have 8 cases. NCDC is actually reporting 6 confirmed cases. Then the state government, Bauchi state government, is reporting 4 confirmed cases. We need clarification. Which figure are we actually going to go out with? Then the second question, in the last few days, we've seen an increase in the number of states reporting confirmed cases of COVID-19, and I'm afraid it's actually spreading further north as we speak right now. And we also know that the NCDC dispatches you dispatch some of your staff whenever a state reports a case. Are you not a little bit worried that the increasing number of states reporting confirmed cases will have an overwhelming effect on the human resources that you have? If you are, what preparations are you making so that your staff will not, your staff strength will not be overwhelmed? Then I would appreciate if the SGF can just give us a response on what the federal government is doing to the alleged maltreatment of Nigerians in China. Thank you.
Good evening, all. Abbas Adebawale Juma is my name, from Daily Trust Newspapers. The first question is for the NCDC DG. There was a reported case of an isolated tribe in Brazil. There was a reported case of an isolated tribe in Brazil, and they've recorded a confirmed cases of the COVID-19. A young boy of 15 that was sick was taken to the hospital. When the treatment defied the malaria they thought was the boy was to be treated for. We have Nigerians going to farms and still getting some things done so that food can be available during the lockdown. How do you explain this circumstance for a community that doesn't have any contact with others, yet recorded a case of infection? That's number one. The second question is to the national coordinator. Despite the directive you announced here, some of the essential workers in court that doesn't have a means of identification, like poultry farmers, those who are going to get the product from the farm, they still have challenges of moving the food to the market for Nigerians to buy. So how do we get this thing done? And Nigerians also sent questions to my office by saying that the governors still on the conflicting directive from the subnationals. That doesn't mean that this committee or any other arm of the federal government does not relate directly to the governor, apart from what the chairman told us, that there was a teleconferencing confirmation. Nigerians want a clarification so that they can know who to work with. Then lastly, the CSO are still complaining that despite this committee's activities, they've noticed some private individuals or some organizations taking food delivery to some communities in the 3 affected places of lockdown. And they seem now that this thing is not coordinated in view of the physical distancing measure by the government. Thank you very much.
The Chairman, Honorable Ministers, my colleagues. My name is Amaka Ude. I report for Arise News. And my own question, first of all, I want to commend the PTF as well as the government in general for all that you're doing really to improve on our testing capacity in the country, because I do know that yesterday the Ministry of Science and Technology, in collaboration with the Ministry of Health, you launched the mobile testing for COVID-19. So, Honorable Minister of Health, I'd like to get an update on that. And also, you spoke about working hand in hand with the private sector, especially as it concerns testing, because experts, including Professor Tomori, Nigeria's own, well-acclaimed virologist, has said Nigeria needs to improve on our testing capacity. So you spoke about working with the private sector and, accrediting their labs. So we want to get a time frame when we see more testing facilities, especially from the private sector, so more people can get tested. And with your collaboration with the private sector, will the testing be free, as we're seeing now in the government facilities? So we need clarifications on that. And also to the DG of the NCDC, and as well as the national coordinator and even the chairman, any one of you can pick up on this. The lockdown that Mr. President declared is almost over. So while we await Mr. President if he's going to extend the lockdown or we end it here, Nigerians really want to know, what are the things we need to do or not to do to return back to normal? Thank you.
Chairman of the Task Force, Honorable Ministers, my colleagues, my name is Emmanuel Kutara from Radio Nigeria. My first question, SGF sir, I don't know whether you are aware, there is a report from China, Guangzhou, precisely, Africans, including Nigerians, are being evacuated from their homes and hotels. And they are being accused of having or being positive to COVID-19. I don't know whether you are aware of those reports and your response to that. Secondly, to the national coordinator, we know that there are some palliatives that are being shared. And I don't know whether you have any tracking mechanism or feedback to know whether those palliatives are being given to the right persons, because there are reports that there are some that are given half, some 1/4, some they don't even have any. Also, to the chairman, in health, we have human health, environmental health, and animal health. In your committee, you have representatives from the human and the environmental. I don't know why you didn't include that of the animal health, maybe the Minister of Agric. Thank you.
Good afternoon, everyone. First and foremost, I want to ask the Honorable, my name is Mitaire Ikben from the NTA. I want to ask the Honorable Minister of Information and Culture, beyond several appeals to Nigerians to shun and desist from fake news, what is the Presidential Task Force and the government doing to deal with the issue of fake news, which goes viral? And my second question would be that beyond the provision of palliatives and relief supplies, there are some communities, some far-flung communities that do not even have water supply, potable water to practice personal hygiene. What is the government doing? What is the collaboration between the federal and state governments to ensure that at this time when we are battling a pandemic, what is being done to ensure that such communities get water supply? Thank you.
Oui, bonsoir. Je m'appelle Ernest Ege. Je suis avec Voix du Nigeria, Voice of Nigeria. Je m'adresse au ministre de l'Information et de la Culture, M. Lai Mohamed. Un des problèmes que nous avons, que nous ne voulons pas dans cette période pandémique, est la propagation de fausses informations. Nous voulons savoir, en dehors de ce briefing national et des interviews, qu'est-ce que vous faites pour freiner, ou bien qu'est-ce que vous faites pour mettre au terme la propagation des fausses informations? Et la deuxième question que j'ai ici, les Chinois, ils sont venus ici pour nous aider à lutter contre cette maladie COVID-19. Ils sont venus avec leurs kits médicaux. Nous les avons acceptés ici. Ils sont nos amis. Mais pourquoi ils nous chassent de leur pays? Ils chassent nos frères et sœurs de leur pays. Pourquoi ils saisissent nos passeports? Qu'est-ce que nous avons fait? Et je vais répéter en anglais, I will say it in English now. One of the problems we would not like to have in this period is fake news. And apart from this briefing, national briefing, and maybe some interviews, are there other means you're using to curb the spread of fake news? And the second one is the Chinese. They came in here to help us fight this disease, coronavirus. We accepted them. They are friends, but they are chasing us from their country. They're seizing our passports. What have we done? Thank you.
All right.
Good evening, SGF, honorable ministers, and my colleagues. My name is Femi Akonde. I'm a reporter with TVC News. Yes, sir. Since the Chinese medical team arrived in Nigeria, there has been so much, should I say, information and misinformation and even distrust about what the government is telling the people about about the mission of the Chinese people here in Nigeria. And today the Nigerian Medical Association released a statement where paragraph 3 reads that we are aware that the Chinese team will provide CCECC employees with critical and necessary healthcare assistance, as stated by the managing director of the CCECC. It does not seem likely that the team will not have contact with Nigerian patients, as the presidential task force will have us believe. CCECC has Nigerian workers among her employees. Sir, what really is happening? We need to set the record straight. Are these people here to assist us or to treat Chinese citizens in Nigeria, or maybe staff of CCECC? And again, sir, you said that we do not have shortage of the PPEs. That's the Minister of Health, sir. We do not have shortage of the personal protective equipment, and you don't even see us having any shortage very soon. But again, the Nigerian Medical Association is saying we call on healthcare professionals to be wary of uncertified personal protective equipment from China, because I believe what you are saying, that we don't have shortage of this because of the equipment we have received from China. Have they been certified? Have they been tested? Are they good for use? Please help us clear these doubts.
Thank you very much. We have taken all the questions into the basket. They have been directed at the Honorable Minister of Health, the DG NCDC, the National Coordinator, the Minister of Aviation, the Minister of Information and Culture, and the SGF. We will take the answers in this order. Honorable Minister of Health, followed by the DG NCDC, followed by the National Coordinator. Thereafter, we shall take the Minister of Aviation, the Minister of Information and Culture, and the SGF will round it up. Honorable Minister of Health.
So, Secretary to the Government, Honorable Ministers, ladies and gentlemen. The first question has to do with whether we are doing better with regard to our COVID-19 response. And that's a very important question. It's important because the essence of what we are doing here, what the Presidential Task Force is about, just that. And you can answer it in several ways. If you look at the figures that we have, today we have 288, the other day we had less than that, and so on, you could say we are increasing. We are not doing well. You could say so. But on the other hand, if you compare the figures that come from Nigeria with other countries, you will say, well, we are not that bad off at all. And particularly if you want to extrapolate it with the population and the volume of travelers, you will say, well, we look to be doing well. And then you can also compare with what some organizations modeled. They modeled that by this time Nigeria will really be in very serious trouble because of the way our country is structured, our dense population and so on. That hasn't happened. Now, we have not mentioned that until you ask it now, because we don't want to rest on our oars. We are not out of the woods. The problem can still be very serious, and we still have a long way to go and a lot of hard work to do. So, while on the one hand the figures have increased, and on the other hand, relatively speaking, we do not have the figures that others have, and we are not having as many fatalities as other countries. We know that the situation for our country is extremely important and very, very of great concern, let us say. It must be delicate for us to continue to, not to rest on our oars, but to continue to push further. So, the other question is regard to the team from China. The team from China are experts who came here to first of all, let me say that they are under quarantine. We told them that when you enter our country, you have to be under quarantine. And they said they understood. And we also told them that before they come, and we asked where they will do the quarantine, they said they have a hospital, they have a compound. And we said NCDC will go and inspect that compound, inspect the quarantine before they come. So that one happened. NCD went there to inspect and saw the quarters there where their hospital or their quarantine is. We also asked them that every day NCDC will have access whenever they like to come and inspect. So that is what they are, have agreed to. Now, whether they're treating people, treating Nigerians or not, I doubt. Because if you're in quarantine and they understand that they're in quarantine, and I believe they already have arrangements there for themselves, it's not these new strangers you are going to immediately start using for treatment. I mean, to treat your people. So I do believe that the NCDC will monitor them and see that they're in quarantine. But our main interest in these people is to see, from a scientific point of view, what actually the processes were that they use in their country, what are the tactics that they applied. Because if you want to know something, you ask somebody who has suffered it before. And those who have suffered it, they have gone through heavy COVID-19 infection, they have dealt with it, and I will tell you that they will admit to you that they made some mistakes, they developed new strategies, and they have various lessons and learnings that they have, which we are saying we want these lessons. We want to know how did they deal with their problem. It's part of our own preparation, our own preparedness to protect our people. If you want to claim that we know everything about COVID-19, that's not true. We don't know everything about it. We read about it in papers. We also read about it in journals. We listen to the WHO. But for those who have actually had a hands-on experience, the public health experts there, if they can help us with information about how they solve their problems, we shall learn a lot from the point of view of the Ministry of Health. We have told them that even though they're quarantined, if they can join us by video conference to begin to ask questions already so that they don't waste the period. So as from next week, we join by video conference so that we start asking them questions. They are preparing translators to help them to give us the benefit of what they know. So that is the issue of I think that's all about that question. And we have also told them that whatever it is they brought will have to be certified by NAFDAC, whatever medicines they brought. But I must also remind you that what they brought to us are gifts. We didn't pay for it. We didn't pay one dime. They even paid for the transport, for the shipping to come here. So what we say to them, first of all, and they did all of this in spite of shortages that are global. There are global shortages. Not many countries can get everything they want at the moment. So we do appreciate that they brought these things to help us and support us here. And the medicines will be certified by NAFDAC before Nigerians will take those medicines. So I think that answers the question.
Thank you, Honorable Minister of Health. Director General, NCDC.
Thank you. Very good questions, as always. The first one was if we're documenting the response. I think that question should go back to you. You're the journalists in the room. I hope you're documenting the response. Our responsibility is to do the response and do it the best way we can. So I really look forward to your stories as you document the very hard work healthcare workers are doing across the country. The second one was on community spread. Yes, we are seeing some early indications on community transmission. And that is why we say that I think yesterday, the last time I presented these figures, about 30% of patients, we haven't quite figured out from whom they got that infection. So that's an early indicator of community spread. But we are working extremely hard right now. That's the purpose of the lockdown, was to enable us to do this work. We can confirm that we know and are following up 91% as at yesterday of all the contacts of all the confirmed cases. So as at yesterday, we had identified and are following up every day 91% of all the contacts of confirmed cases that were confirmed up to the end of yesterday. My friend in channels asked about the discrepancy in the Bauchi cases. We had previously announced that there were 6 cases, and then we updated this to 4. Ladies and gentlemen of the press, yesterday at 9:30 p.m., we announced publicly that yesterday, I'll read it out verbatim, because we have promised to always be transparent in our communication. Yesterday we erroneously reported 2 new cases in Bauchi. Following further review, we can confirm that these were repeat tests for previously confirmed individuals. We apologize for this error, and we remain committed to ensuring transparent and accurate reporting of test results. This was made public yesterday. That commitment stands. Every new case, every new confirmed case is followed up by testing every 48 to 72 hours. There's no other way to know whether you've cleared the virus. So sometimes when these forms and samples come to the labs, it's not always easy, because sometimes the forms are not complete to say whether this is a new case or a repeat case for a repeat test for an existing case. So in this particular case, there was a mistake. We corrected it. We made it public. I think we did the right thing. In terms of our staff strength, yes, as at yesterday, we had teams deployed to 17 states in Nigeria. And you're right, the colleague that asked the question on whether we will have the capacity to keep doing this. You know, sometimes you plant a tree many years ago and you never know the value it will add. So 11 years ago, a tree was planted in Nigeria. It's called the Nigeria Field Epidemiology and Laboratory Training Program. It's in its 11th year. Every year we admit 50 individuals to train them on a 2-year program on field epidemiology. These are all public servants. They come from the states. They are trained for 2 years with us. They go back to the states. So what we do when we are responding to this, we bring them back into the teams. They already know how we work. They've worked with us for 2 years throughout their training. So really, this is the resource that we're now pulling into the country to support our response as we deploy. So in many of these teams, there might be 1 or 2 NCDC core staff. The rest are around field epi graduates across the country. But no doubt, we're working hard, and we've gotten assurances to increase our staff strength. There's no way that the numbers of individuals we have in NCDC will support us into the future. But that's an intention for the future. Now we have to make the best of what we have. There was a question on Brazil. I really don't know the details of that specific case, so I'll look into it a bit more after this press conference. I think the last question was on fake news. And there was one relating to us directly yesterday, flying around about how we spent 1 billion naira on SMS messages. You know, we keep trying to debunk these messages and keep trying to focus on the work that we're doing. The work that we have to do on behalf of all of us is hard enough on its own. So there's nothing else we can do but to hunker down and focus on that work. I really rely on you that see us every day here, feeding back to you, to share some of these stories. Everyone across this room is working literally 18 hours every day. We are not looking for praises. It's just to say we are working very hard to make sure that we can get ahead of this curve. There was no 1 billion naira spent on SMS. In fact, we haven't spent a single naira on SMS messages. Every single SMS you get with NCDC messages have been supported by the private sector, paid for directly by some of the big telcos in Nigeria. And they support this. There wasn't actually any transfer of cash. I actually don't know what they have paid, if they have paid anything. I received the text messages just like you do. So that is just to assure Nigerians that as we carry on this response, the accountability for the resources that we've been given to carry out the response is very important to us. And we've received very clear instructions from Mr. President to make sure that every naira we spend is spent well and can be accounted for in the response. Thank you. Thank you, Rachel. The lessons from the outbreak are not only being documented, because this is a new virus. They're being used every day to shape the response. So every day, like I've said severally, we are learning, we're documenting, but more than documentation, we're using it. So that's the purpose of the EOC that we have, where new ideas are brought in, strategies are changed. You would have noticed the case definition has changed a few times. That's because someone is thinking, how do we change this as the outbreak proceeds? So thanks for clarifying.
Thank you. So I believe I had a few questions. The first one, I can actually merge them. I think there were two questions that can be merged into one. This relates to the issue of banks and other essential services opening, and whether animal husbandry is included in farming, as well as other essential services and people that do not have identity cards. So you may recall, I think about a week or so ago, we shared with you the guidelines and protocol for the lockdown. And as part of that, we quoted from Mr. President's speech, where he made clear exemptions for services such as financial services and agriculture. I subsequently came back and confirmed a few days later that when we say agriculture, this also includes animal husbandry. Those guidelines and protocols we have shared with the security services. For people who are within these occupations, we expect the security services to comply with our guidelines and respect the decision by Mr. President to exempt certain groups from the lockdown. In terms of the banks, the same. We expect them to provide skeletal services. I know we're going into a major public holiday, so that might explain why maybe some of the banks have run out of money, ATM-wise, etc. But we certainly have given them the go-ahead to continue to provide skeletal financial services to the public. This is very essential for our economy. In terms of interaction with the states, just to let you know that we do have a representative of the Nigeria Governors Forum in our secretariat, and we are working with the chair. In fact, just today I had discussions with him as to what to do to bring forward a representative onto the task force. I'm also due to have additional discussions with the chair of the Nigeria Governors Forum, and on a weekly basis we now have a video teleconference with the state commissioners of health. So we are working very closely with them. As I've always said, this is not an epidemic that is confined to Lagos and Abuja. Epidemics do not respect any physical boundaries. In terms of civil society, we continue to welcome the role of civil society in this response. Community engagement is really essential. We know the civil society have a very good reach into the communities. Algon, for instance, has been working with us at the community level. I understand Nestle, one of the private sectors, has been distributing food packs throughout Abuja, which is really welcome. Government cannot do this alone. This is a partnership. We need to work together. We also need to be kind to our neighbors, our friends, and maintain that community spirit that Nigerians are well known for. The issue of palliatives and whether we're monitoring this or not, as the public are aware, the task force is a multi-sectoral arrangement. So we have the Federal Ministry of Humanitarian Affairs, and we also have NEMA. And all these ministries and allied agencies provide reports regularly to the task force. So in terms of monitoring, yes, we are monitoring, and we hope that by the end of our national assignment, we'll be able to provide Nigerians with very clear detail of what was done in terms of the palliatives that have been distributed, etc. What do we need to do to return back to normal? Well, this is an epidemic, so we need to work together to stop new infections and make sure that those that are infected get well and go back home. So any measure that you can do to achieve these two aims will get us back to normal. Thank you.
Honorable Minister of Aviation.
Mr. Chairman, distinguished ladies and gentlemen, my friends, gentlemen of the media. I think the coronavirus, COVID-19, is a very, very serious universal issue or matter of life and death. And so it cannot be politicized. And pursuant to Chapter 2, Section 14 of the Constitution of Nigeria, which states the primary purpose of government to ensure security of lives and property. That's why the task force COVID-19 was established by Mr. President. So it involves the lives of 200 million of all of us. And it takes precedence in this case. Now, the question about the pilots were carrying out national assignment because the speech and address by the SGF, who is the chairman of the task force, and the presidential address exempted oil and gas from the lockdown or shutdown in national interest. And these Cabotan helicopter pilots were flying into the military base for national assignment. Of course, I may not be learned, but I'm lettered. And I understand, if any, in this case there is none, the conflict between a federal and a state law, but I will not argue law on this platform. It's unnecessary. As I said, I'm lettered, not learned. So whether His Excellency, the governor of Rivers State, ought to know if the exempted Cabotan flight will be landing in the military base in Port Harcourt, belonging to the Nigerian Air Force. He does not need to know. So that is answer number one. Answer number two regarding the pilots. The pilots will soon be released, will be secured, and there will not be any conviction hanging on their necks. And arising from the constitutional provision and the powers of Mr. President and the seriousness of this task force and the danger of COVID-19 and the way we operate civil aviation, including military aviation, that's why I said that the Air Force officer acted ignorantly when the chopper landed on his property to have called the governor, and also the federal police who made the arrest within the premises of the military and prosecuted also acted ignorantly, and I said they exhibited incompetence. So, and this matter should not be overflogged. Federal government is a very serious matter. It is there for the 200 million people of Nigeria, whether you're from Rivers or Cross Rivers, from Kano or from Kaduna, regardless. Thank you very much.
Honorable Minister of Information and Culture.
Thank you, gentlemen. Fake news has been around for quite a while. In 2017, my ministry devoted an entire National Council on Information summit in Jos, Plateau State, to address the issue of fake news. Because from that moment, we knew that fake news poses a real threat, not just to our democracy, but to the very existence of our country. In July 2018, the ministry launched a national campaign against fake news. This campaign took us to many media houses across the country. And we got the buy-in of many media houses. International platforms, social media platforms also supported us. But yet, fake news has refused to die. Now, but you see, you must ask yourself, what are the motives for the purveyors of fake news? And this is where the real problem is. There's a proverb in Yoruba. It says, "Èèyàn méjì pàdánù rọ, tí ẹni tó ń bá ń pa fún tí ò bá mọ̀, ẹni tó ń pa mọ̀ pé ò mọ̀." Translated roughly, it means two people cannot be victims of falsehood. If the fellow who is hearing it is a victim, the purveyor knows what he's doing. And this is why it's very important for us to interrogate the motives of the purveyors of fake news. And there are many motives. For many of them, the 2019 election is not yet over. And for them, is that we must bring down this government, pure and simple. For many of them, it is about attacking the integrity of some individuals, attacking the integrity of programs of government, so that the government will not achieve anything. If you look at the kind of fake news that we've witnessed since COVID-19 started, you begin to appreciate what I'm saying better. I'll just give you 3 or 4 examples, and you see where they are going. They said the committee has decided and agreed on a formula to share whatever money is collected. That attack is on every member of the committee. They are attacking the integrity of the committee. So whatever we say, nobody will take seriously. They said, I said 100 billion naira has been given to people of Nigeria, and that there's actually no hunger in the land. It is to incite Nigerians against the government and against the committee. Then they turned to the DG of and said he has spent 1 billion naira on text messages. Of course, they know that the DG of the Center for Disease Control is a key person in this war against COVID-19, so let's destroy its integrity. Then they turned again and said, yesterday, a particular cleric said, the Chinese people are here actually to treat Mr. President, who has COVID-19, and also some members of the cabinet. So you see, you might think this is funny. It's not funny, because they know where they know their aim. They want to destroy the committee. They want to destroy the fight against COVID-19. They want to destroy the government. And it's so sad that otherwise intelligent people believe them. Like they say, once there's poverty, the first casualty is integrity. Now, we're also documenting this fake news. We're investigating the websites. We're also investigating the proponents. And I can share this with you that when we traced those websites, we trust them to people who have a pathological hatred to this government. We trust that to people who have hosted their website outside Nigeria, and we're waiting for them. But you see, I want to take the opportunity to sound a clear warning to all humanitarian organizations, to all the human rights fighters, that no government will fold its arms and allow fake news to destroy it. So when we start taking appropriate action, we hope there will be no complaint from any quarters. Thank you very much. Yes, please. Non, la langue officielle du Nigeria, c'est l'anglais. Donc tout le monde doit parler en anglais. Je n'ai pas une communauté qui parle français au Nigeria. Merci.
Thank you very much, Honorable Minister of Information and Culture. I now invite the Chairman of the Presidential Task Force on COVID-19 and the SGF to please answer the questions posed to him.
Well, I was wishing that some of the questions should have been taken by the Minister of Health, but let me make an attempt. There was a question that had to deal with the Abuja Declaration, where there was a commitment for 15%. I don't know the exact percentage now, but I can assure you that if you aggregate what the federal government is doing, because sometimes we use these percentages and just look at the budget of the federal government. But the federal government is not the only constrained part of Nigeria. State governments are also investing in health and health infrastructure. Local governments are doing the same. I want you to understand the health structure in Nigeria. Primary health system is exclusively the responsibility of the local governments. The secondary health system, that's where the states come in. The federal government has responsibility only for the tertiary. But over the years, there have been abdication of responsibilities. You find federal government even investing in the primary healthcare system. That's why we have an agency. So if you look at the total aggregate of the commitment of government to health, it might not be 15%, but we are near there. Pardon? 4.2. You take the states, add them to the local government, you add them to the federal. That's what it amounts to. Or you are looking at the federal budget only. Obviously, you look at the total aggregate of the 36 states plus FCT. Look at the 774 local governments. Their investment, that's the only way you can arrive at a percentage. Don't look at only the federal government investment. The states are investing, they're building general hospitals. We are not building general hospitals. That's their responsibility. But by the nature of our politics, even at the federal level, you find community or constituency projects that are primary health clinics. If you aggregate the number of primary health clinics we have in Nigeria, it's over 10,000. But how many of them are working? So it's a major issue. And that was part of my address yesterday when I spoke to the National Assembly. I said we need to sit back and reconstruct our investment into the healthcare system. But the federal government is doing a lot. Right now, there's a provision of 1% of from the Consolidated Revenue Fund, which goes to the Basic Healthcare Provision Fund. 1%. Or whatever goes into the Consolidated Revenue Fund goes to this particular fund. I think it's domiciled either in your ministry or in the primary healthcare agency for distribution to different sectors of our healthcare system. So my answer to that is that we are doing good, but not as good as we ought to. Investment into our healthcare infrastructure must be looked at seriously. It must be looked at seriously. Right now, nobody can go elsewhere to seek medical attention. So probably this is the right moment that we have to be reflective and sit back and begin to address these issues. Nobody ever thought that you couldn't go anywhere to seek for medical attention. 3 months ago, if you were told, you would say, no, it will not happen. But we are all confined here now. Those of us that come from the rural areas are still rugged enough to be on our feet by the grace of God. But we can't take these things for granted. We can't take these things for granted. So much is expected, and I believe that this would help us reflect on how we deploy our resources going forward as a nation to care for the basics that touches the life of the people. About our engagement with the Governors Forum. We have engaged, and we continue to engage. The first thing we did was that during the National Economic Council meeting, the last one, I attended, the Minister of Health and the Minister of State and the DG and the National Coordinator attended, and we had the privilege of briefing them about the activities of this task force. We followed up by teleconference with the governors because of the cessation of movement. We can't move. So we followed up with that. And on a daily basis, I speak to the chairman of the Governors Forum so that we can be on the same page. The DG of the Governors Forum has attended the meeting of the task force and discussed with us. We have even allowed them a representation into the working committee so that they can have up-to-date information on a daily basis as to the activities of the task force. So in terms of engagement, I don't think we are lacking there. But we have to be on the same page. And even in the context of my address today, I did mention that we cannot operate different response. We must operate one national response with the subnationals fitting into the entire national response. Treatment of Nigerians in China. It's a matter of concern, and how I wish the Honorable Minister for Foreign Affairs is here. But I can assure you that he has taken up that matter seriously. The information available with me, to me today, is that he met with the Chinese ambassador yesterday to convey to him our concern about what information is coming out. I saw some of the the clips that are being run on social media. But I must commend the efforts of our officers there, our diplomatic officers in China, because in one of the videos I saw was one of our officers holding Nigerian passports, and he was confronting a Chinese official and asking him whether he had the right to do what he was doing. And I think we are taking steps. And the first step diplomatically was to invite the ambassador to formally lodge that complaint. And I believe that we will receive positive response to that. But I can assure you that it is the responsibility of the Nigerian government to protect our citizens wherever they are on the face of the earth. And we will not renege on that responsibility. We will do everything to assure them and secure their protection, and to such a time that if they desire to return home, we would also work towards facilitating that for them to come back home. We have been working on that. A lot of discussions are going on. We've asked the Diaspora Commission to network and ensure that they get the details of our people wherever they are through the embassies, so that we can have a comprehensive list of those that are desiring to return, and what are the processes we will put in place to ensure that they come back home. Lockdown. Well, the decision for either to extend the lockdown or not is exclusively the responsibility or the decision of the president. Ours is to provide him with background information that would inform that decision. So I cannot speculate on that now. But looking at what is happening in other climes, you will be able to deduce what might likely happen. But I'm not in a position to speculate on that. I believe strongly that the information that is required will be made available to Mr. President, who would look at the holistic picture, because it's not only the information that comes from the Presidential Task Force that would inform his decision. There are other sources of information that comes to his desk as the President of the Federal Republic of Nigeria that would inform a considered decision in this matter. Thank you.